Have you ever noticed that the human body has mysterious ways of warning you when something is wrong? Even before pain appears, it sends out small signals, subtle but powerful ones, and one of the most surprising of them is smell. Yes, your body can actually change its odor when something serious is happening inside. Science has already proven that certain types of cancer produce chemical compounds that alter the natural smell of the body, sweat, and even breath. The most frightening part is that these signs can appear long before any other symptom. That's why today you'll discover 5 odors that may indicate the presence of cancer silently growing inside your body. Pay close attention until the end, because understanding this could literally save your life or the life of someone you love. Let's begin. Colon cancer can be silent for a long time, but in many cases, it leaves noticeable signs, such as changes in body odor. Think of the intestines as an ecosystem full of bacteria that play a vital role in digestion and overall health. When a tumor begins to develop, it disrupts this delicate balance, causing the release of chemical compounds with unusual and distinctive odors. These odors can manifest in different ways. For instance, stool may emit a stronger, more acidic and persistent smell than usual. This happens because the tumor can interfere with food digestion, increasing the release of sulfur-rich gases like hydrogen sulfide, which has a strong, unpleasant odor. In addition, the presence of blood in the stool, even in small amounts, can produce a metallic smell similar to iron, which is not typical of normal body function. Such changes are often mistaken for simple digestive problems or the result of certain foods, but they serve as an important warning. Another common feature is that intestinal gas may develop a much stronger or different odor, especially if toxins accumulate due to partial obstruction of the intestines caused by the tumor. In more advanced cases, even breath can be affected, producing an unusual odor some people describe as similar to rotten food or chemicals. This happens because compounds produced in the intestines can be absorbed into the bloodstream and exhaled through the lungs. Understanding these changes is crucial, especially for people over 50 who are at higher risk for colon cancer. If you notice persistent and unusual odors, particularly accompanied by other symptoms, such as changes in bowel habits, unexplained weight loss, or constant fatigue, seek medical advice immediately. Another type of cancer that can cause unpleasant odors is liver cancer. The liver is a vital organ responsible for filtering toxins from the blood, metabolizing nutrients, and producing substances essential for the body's proper function. When cancer compromises these functions, the body can manifest chemical changes that result in unusual and persistent odors. One of the most frequently reported odors by people with liver cancer is a smell resembling ammonia or rotten fruit in the breath or sweat. This occurs due to the buildup of toxins in the body, since a diseased liver can no longer process them properly. In addition, high levels of bilirubin in the blood, common in liver cancer cases, can intensify this smell, especially in people with jaundice, the yellowing of the skin and eyes. The altered metabolism of food and the breakdown of proteins by a damaged liver can produce distinct chemical odors, often described as sweet or unpleasantly acidic. These smells can be especially noticeable on the breath, even after brushing or using mouthwash, and in sweat, which may become unusually strong. If these changes in body or mouth odor come with other symptoms like extreme fatigue, unexplained weight loss, abdominal swelling, or pain in the upper right side of the abdomen, seek medical evaluation immediately. Detecting liver cancer in its early stages is crucial for effective treatment. The third type of cancer that can cause strange odors is lung cancer. Although this disease mainly affects the lungs, responsible for the body's gas exchange, the impact of cancer can alter the composition of exhaled air, leading to noticeable and unusual odors. People with lung cancer sometimes report breath with an acidic, chemical, or even rotting meat-like smell. This happens because lung tumors can produce specific chemical compounds, known as volatile organic compounds, VOCs, which are released directly into the air, being exhaled. These substances have distinct and often unpleasant odors. In addition, secondary lung infections common in cancer patients can intensify these smells, creating persistent foul breath. Another important aspect is the increase of gases like hydrogen sulfide, which can be released during breathing in people with advanced lung damage. This gas, responsible for a sulfuric or rotten egg odor, can be an indirect sign that lung tissue is being affected. These changes should not be ignored, especially by people in risk groups, such as smokers or those with long-term exposure to toxic chemicals. If these unusual odors are accompanied by symptoms like persistent cough, shortness of breath, chest pain, or hoarseness, consult a doctor right away. Detecting lung cancer early can make all the difference in treatment and recovery. Leukemia, a type of cancer that affects the blood and bone marrow, can also cause changes in body or mouth odor. These signals are related to the metabolic changes the disease triggers in the body, especially as cancer cells interfere with the normal production of blood cells and the elimination of toxins. People with leukemia may have breath that smells sweet, chemical, or metallic, often described as unusual. This odor may result from toxin buildup in the blood, since the body struggles to filter waste and regulate metabolism. Common gum infections due to low immunity in leukemia patients can also worsen the unpleasant smells, such as the odor of decaying meat. Another important factor is anemia, almost always present in leukemia, which can lead to a metallic odor in the breath. This smell is associated with the iron in the blood and the breakdown of hemoglobin. Metabolic changes in proteins can also release ketones, producing a sweet and acidic smell similar to what's observed in people with uncontrolled diabetes. Although subtle, these odors can be a warning sign that something is wrong. If they appear along with symptoms such as extreme fatigue, recurrent fever, unexplained bruising or bleeding, seek medical attention immediately. Detecting leukemia early can mean the difference between effective treatment and serious complications. Another cancer that can be identified by smell is oral cancer. Although it's natural for the mouth to have some odor, especially after eating certain foods or due to poor hygiene, cancer in this region can cause strong, persistent, and hard-to-ignore changes. This happens because the tumor interferes with healthy tissue, causing inflammation, necrosis, and secondary infections that release chemical compounds with distinctive and unpleasant odors. One of the most common smells associated with mouth or throat cancer is fetid or putrid, similar to rotting meat. The breakdown of tissue and the presence of bacteria thriving in the environment created by the tumor also contribute to the foul odor. In addition, frequent bleeding or the presence of blood in saliva can cause a metallic or strange breath smell. Tissue necrosis can also release chemicals absorbed by saliva or exhaled through the breath, making the odor persist even after oral hygiene. These signs should not be ignored, especially if they come with other symptoms like difficulty swallowing, persistent mouth or throat pain, voice changes, or the sensation of something stuck in the throat. Each of the 5 types of cancer discussed here has distinctive odors that, although often overlooked, may be the key to early detection and effective treatment. Recognizing these signals and watching for other symptoms is a way to take active care of your health and act in time. If you notice something unusual in your body or in someone close to you, don't hesitate to seek medical advice. Detecting these changes early can make all the difference, saving lives and offering a better chance of recovery. Knowledge is a powerful tool. Use it to protect your health and the health of those you love. Thank you so much for watching. And see you in the next video. May God bless you always.